Even with growing awareness of the crisis in pediatric mental health, children in minority communities are less likely to get services compared to their white peers.
Black and Hispanic youth are half as likely to get help compared to their white counterparts. And earlier this morning, we were joined by Farah Moram with the Healthcare Network to talk about what we can do for our children. Farah, thanks so much for joining us to talk about this.
My pleasure. Thank you for having me.
This is such an important topic. So what are some of the barriers for these children, these minority children, when it comes to mental health care?
There are a multitude of barriers, one of which is inadequate healthcare coverage for minorities and a shortage of specialists in the area. And many times, too, primary care providers lack the training or confidence to be able to treat children altogether, and that magnified for minorities by 100-fold.
It's expensive too, even if they can find a provider.
Absolutely.
So what are the consequences of this disparity from this?
And many times, going back again with this initial questions, many times biases of providers is also a barrier. And when you think about the providers who are not aware of their own implicit bias, and that can definitely be a barrier for care, for access to care. The consequences are massive, one of which is minority children experiences increased school discipline, for instance, suspension, expulsions, and many times those concerns are mental health related. We see that minority children are less likely to receive quality care. They are more likely to be misdiagnosed or underdiagnosed. And right now we see that too. Minority children, specifically young Hispanic and Black male, are at the highest risk for incarceration. Recently there was a data that came from the Department of Justice. 50% of individuals who are incarcerated have mental health concerns, and those individuals were not previously diagnosed. So we see that there is a disproportionate contact with our youth, with the juvenile justice system. So we see that again, the incarceration rate is overrepresented by minorities.
You see the effects so much. So tell us quickly what Healthcare Network is doing to help the disparity here with minority children.
That's a very good question. Since Healthcare Network opened its doors in 1977, we've been serving migrant farm workers in Immokalee. And over the years, we branched out to serving the whole community, Naples and Immokalee. And with our integrated healthcare services, individuals from the community can benefit. What that means is that once they come to see the primary care physician, they have access to mental health and behavioral health services as well, and that decreases the stigma that many minoritized populations face.
And even culturally, it's hard to talk about within a lot of families of these minority children.
Absolutely, and cultural beliefs and internalized stigma is one of the biggest barrier too, because when you think about some of the Hispanic or Haitian population with limited English proficiency, so it's difficult for them to even understand what that means. But when you have a mental health provider or primary care provider who understand what that means, and they can help educate them, in this sense they can access services easier.
So many factors going to this very important topic. Farah, thank you so much for joining us this morning.
Of course, my pleasure. We can be reached very easily. Our phone number is 239-658-3000, or we can be reached at healthcaresouthwestflorida.org.